Good morning, everybody. So, what all have you learned in pathology so far? Shock has been taught?
Yes.
Okay. So, what was the first class after introduction? Cell injury mechanisms. Right. Then, whether that injury is going to lead to a reversible or an irreversible change. Right? In reversible, what all did you read? What are some examples of a reversible cell injury? Huh? Yes? Morphologic examples? If you do not remember the disease entity. Huh? Morphologic. Reversible. Intracellular accumulations have been taught? Yeah? Fatty change? What are the cellular differences between a reversible and an irreversible injury? So you have to know what is reversible. You look at the slide, okay, this is an reversible injury. What is an irreversible that all of you know? Necrosis and apoptosis. It is cell death, right? So then you have to know the differences between necrosis and apoptosis and the, of course, the morphological features. Then what else was taught? Pardon? Intracellular accumulations. After that, once more, pardon? Inflammation. Okay. Then where was this thrombosis? After that. Inflammation, what all did you read?
Acute and chronic.
And mediators. Acute and chronic and mediators. Very important Viva question. Alright. Cell-derived, plasma-derived, mediators always appears. Okay. Then events, inflammation, vascular events, cellular events, right? Then you come to thrombosis. Okay, we've passed 10 minutes, so we cannot waste so much time there. Alright, so, and now we are coming to how does an infection occur? Alright, genesis of an infection, okay? Because later on in your systemic pathology, you will be reading about so many entities, right? So then this is a basic class, basic session to familiarize you with the basics of, okay, this chapter is very long. This is chapter 8 in your 10th edition Robbins, alright? But we will deal with pathogenesis of infections today. Okay, everybody's ready? Yeah. So the objective, just one objective, vague objective, to discuss the pathogenesis of infection. Now, infectious disease, alright, despite the availability of vaccines and antibiotics, okay, they are a leading cause of morbidity and even mortality. Alright, let's say they pose a significant health problem, right? Not only in the developing countries, also in the developed countries, okay? Because in the developing countries, if you have problems with, the nutrition or the hygiene status of the patients, in the developed countries, you have problems of immunosuppression, all right, or maybe these can be a significant cause health problem in elderly. Okay, all right. So becomes a topic significant enough to be placed into the MBBS curriculum. Alright? Oh my god, I'm very sorry about the font. I did not realize, so I think the whole class, this is very bad. Sorry. Okay, so when we talk about you can have the slides, alright? You can't say anything, no? Can't say anything, right? I'm so sorry. Okay. No, but that font keeps coming, right? Better, right? Okay, then I don't have to worry much. Alright. Okay, so we will start with how the microorganism, be it a bacteria, fungi, or a virus, isn't it, or a parasite, how it enters the human body, so route of entry. Following that, how does it spread and disseminate within our body and outside our body to another person. Alright? So you remember the sequence that we will be talking in. Third is, it's spreading in our body, so it's entered our body, and now we as a host and that microorganism as a pathogen, what are the interactions between the host and the pathogen? That is the third component. And the fourth is, in the process, okay, there is damage to the host tissue. The damage to the host tissue can be caused by the microbe or can be caused by the host reaction to the microbe as well. Okay, so damage to the host tissue, the heading says by the microbe. Alright, then in the damage, host damage by microbes, we will not elaborate very much because these are the individual topics that you will be learning later on. Alright, so we'll just touch upon bacterial and viral. That's it. Okay, and finally, whatever is the disease, there are just few, manifestations morphologically. So the responses morphologically. So spectrum of inflammatory response that we as pathologists see. Okay, all right. When the tissue comes to us, that is the morphologic part. Is that clear? Yeah. Okay, so route of entry, so we will start organ-wise. Okay, we'll take few of the organs that are given in Robbins. So for other organs like genitourinary, respiratory, okay, it's the pathogen that colonizes and invades. Okay, whereas in case of skin, okay, it has to be, the protective barrier has to be breached for the organism to enter. It's not necessarily so in other organs. Okay, in the skin, okay, in an intact skin, you are not going to get an infection. Okay, that is the barrier that you have, all right? But, okay, we'll go one by one, all right? So, most skin infections are initiated by, that's what I meant, mechanical injury to the epidermis. So the local defense in case of skin is your epidermis, the epidermal barrier. You know what is the epidermis, right? What is the epidermis?
Outermost layer of skin.
Covering outermost layer of the
Skin.
The skin is lined by keratinized, stratified squamous epithelium, right? That is the epidermis, isn't it? Yes? So how is it different from the stratified squamous epithelium of the esophagus? We don't call that an epidermis, but we call this an epidermis. That we will still call an epithelium, stratified squamous epithelium. This, the layer of the skin, is the topmost layer, right? Epidermis. And beneath that there is dermis. And beneath that there is
Hypodermis or
Yeah,
subcutaneous.
subcutaneous. Alright. So why do we use the term epidermis?
Outermost maximum.
Where you see the dermal appendages, hair follicles, eccrine glands, apocrine glands, pilosebaceous units, and so on in the dermis. Alright. So that where you see the adnexal structures, okay, there you call it as epidermis. Right? Otherwise, the squamous epithelium can be seen in other part, lining other parts of the body as well. Okay. So intact epithelium is the barrier, okay, epidermal barrier. Then I have left this column purposefully blank, purposely, so that this you go back, open the 8th chapter Robbins and write down the name of the disease or the pathogen. Okay, and the question will be most probably a problem-based question. And if you don't read this, you may lose your 1 or 2 marks. All right. Okay. So I have left this blank in all the systems so that you go and refer to open your textbooks. Okay. All right. So mechanical defects like burns, any ulcer, any puncture, needle stick injury. So where in this type of injury, what is the pathogen or what is the disease? In needle stick injury, what is the pathogen? What is the disease? In arthropod bite, what is the pathogen that causes the disease that is transmitted through an arthropod bite? Okay. Now, direct penetration. Okay. What could be the cause? So this I have left it blank. I'm only uncovering the topic, not covering the topic. Okay. Because you have to go back and read, otherwise you will not read. Okay. Now GI tract. GI tract, by contaminated food and water, most common manifestation as diarrheal disease. Similarly, here, the major defense of GI tract is the lining, the mucosal epithelial lining. Okay. Then the acid secretions, okay, that are there in the GI tract. So this local defense can fail, the epithelial barrier, when there can be certain microbes which have the propensity to attach and proliferate in the epithelium itself. So what are those microbes and what are the diseases that are caused by those microbes? Okay. Now, acid secretion, there are certain microbes whose eggs and cysts are resistant to the digestion by the acid of the GI tract. What are those? Helminths or trophozoites of what? Okay, so what are those diseases? Okay, now peristalsis is, what is peristalsis? Movement, all right, of the bowel. Okay, so it can be, it also serves as a defense mechanism. Okay, in eliminating the microorganisms. Now, peristalsis can be hampered if there is an intestinal obstruction, okay, or if there is a paralysis of the intestine, usually following surgery. All right, the bowel movements have not come back to normal if the bowel has been handled. All right, and post-surgical adhesions also can hamper the peristaltic movement. All right, so what supervenes here? What takes advantage of this weakness when we face? All right, so that part you have to go and fill up. Okay. Now there are bile and pancreatic enzymes. Certain microorganisms are resistant to these, and they can establish an infection and cause the disease. All right. Now, we have protective microbiota in our body known as the commensals. Okay, too much antibiotic use can destroy these and there can be infections. Okay, all right. So, Respiratory. Now, is it clear so far? Just few gaps are remaining which you have to fill, alright? Because if I only speak, you will not remember, okay? So be it virus or bacteria or fungi, we have we're at the risk to inhale it through dust or in aerosol particle. What is an aerosol particle? Droplet infection. All right, good. Okay, so if the particle is a large one, then it is trapped in the mucociliary lining of the throat, okay, nose and the upper respiratory tract, and it is transported, pushed back, okay, to the throat, and then it is swallowed and cleared. But if it's a small one, it finds its way towards the lung. But still, there also, the macrophages are sitting there, the alveolar macrophages, they will take care of these smaller pathogens. Alright, so if the disease has to occur, there has to be something wrong with the mucociliary action, something wrong with the alveolar macrophages. Right? So, mucociliary clearance and resident alveolar macrophages, okay, they are not able to kill the pathogen that they have phagocytosed. So some pathogen, they grow within the macrophage. This is very important topic that you will be learning later on. So I think you are all very, curious to go back, open your books and find out what this is. Alright? Okay? And yes, mucociliary clearance, some microbes, they attach and proliferate within the lining and some cause ciliary paralysis. Okay? The cilia is not able to do its function. Alright? Function of the clearing. Alright? Okay. Now only you want to read? No, don't do that. Okay, now, urogenital tract. See, voiding of the urine is very important mechanism, okay? So, we advise children, right? Children are the ones who, they keep playing and then they forget, they don't go to use the washroom, right? So, that can be one of the reason, okay? That is one of the protective mechanism, let's say, your voiding of the bladder, voiding the urine, okay, emptying your bladder. Alright, so regular emptying is important, okay. Now, the access to the urinary tract by a pathogen is almost always through the urethra, and here you have, you come to know that the females are more prone to urinary tract infections than males because of the shorter length of the urethra in the females, because the access is almost always through urethra, via urethra, alright? Now, so yeah, and then, so regular emptying, we have said, we've said its importance, and so, one is, you are not regularly emptying, why? Either, the patient is not, the person is not regularly emptying himself, or there's an obstruction to the urinary flow, or additionally, there's a reflux of the urine. Okay, so there are certain diseases, okay, in your renal system, which you will learn about. Okay, renal is in unit. Huh? Overall, in H3, next unit what are you going to read in the next unit? Huh? Are you serious? Unit 1 now unit 0, you will go to unit 1. What? Blood, immune system, right? Unit 2, you will learn about something very important here, okay? Respiratory and serious, okay? Unit 3, GIT and hepatobiliary. 4, endorebro kidney, skin. Alright, 5 is CNS and 6 is your multi-system seminar. Next year. So you'll be learning about kidney next year. Alright, okay. Now, lactobacilli in the female, in the vagina, okay, that it protects the growth of the pathogen, okay. So if you're taking antibiotics, you suppress the lactobacilli growth, okay, there can be super infection, there can be, chance of fungal infection, alright. Okay, so urination, normal vaginal microbiota, antibiotic use is going to destroy this. Urination, obstruction to the voiding, okay. or even if it's voided, it's refluxing. Okay, it's coming back, right? So there are certain entities where this can happen, okay, and the patient is prone for, higher urinary tract infection, okay, to the kidney also, all right? Now, intact epithelium, if it is damaged by trauma, or the microbacteria, some of the microorganisms can attach and proliferate here. This is in patients with shorter urethra, okay, the E. coli, all right, from the stool, okay, can go in because the entry is via the urethra that we've said, all right? Is it clear so far? Yeah? We spent half an hour only on route of entry. So now, one important method of transmission is vertical transmission. Do you know what is vertical transmission?
From mother to the newborn.
Have
or
you read
fetus.
about this? No? But how do you know? Huh?
Ketika sudah.
You've heard about it. Mind is not an empty slate, right? Yeah. Okay. So vertical transmission from mother to fetus or the newborn. Fetus or the newborn. Alright. So that is one mode of we are shifting now, okay, to transmission. So vertical transmission. So from mother to fetus or newborn can occur during by placental fetal transmission, or during birth, or even after birth through maternal milk. Okay? So in utero, okay, during birth and after birth. Okay, so placental fetal transmission, some important diseases like rubella. Now, again, the infections that can cause, the organisms that can cause significant diseases depend upon the virulence of the organism and upon what time of the fetal development has the child been infected with this particular infection. Okay? The same rubella infection, if it occurs in the third trimester of pregnancy, not much damage to the newborn because the development has already occurred. Okay. Now, the same rubella infection, if it occurs in the first trimester of a pregnancy, it can lead to malformations. All right. So, affect the development of the child. All right, the fetus. Okay. So, rubella infection during first trimester, it is important to write. All right. So, rubella infection during third trimester is not very significant. Okay, is that clear?
Yes.
Transmission during the birth, from the birth canal, gonococcal infection and chlamydial infection can cause conjunctivitis in the child. Okay, then postnatal transmission in maternal milk. Okay, diseases, organisms like HIV, hepatitis, and cytomegalovirus are known to be transmitted by secreted in the maternal milk and transmitted through the milk. All right, lactation, during lactation. Spread and dissemination. We come further to spread and dissemination. So infection has occurred. You have seen one important thing in the within the inflammatory cells, the microorganism will proliferate. Okay, then they can some of the microorganisms, okay, cause the disease by transmitting through the nerves. What is one disease? It's written here. It's written. Rabies. Alright. Transmitted through biting of a rabid dog. Right? Okay. And varicella zoster is also another example. Okay. Now, spread within inflammatory cells. Okay. Tuberculosis. Then they can go through the lymphatics and cause the disease in the local regional lymph node, okay, the draining lymph nodes of that particular area, or it can spread through the blood. Now, when a disease spreads through the blood, okay, there can be a more disseminated form of infection. Okay. So, introducing you to this term which you have already learned. That's why in the beginning I asked sepsis. So, disseminated. What is sepsis? Okay, it's a disseminated infection, okay, leading to a systemic inflammatory response. Okay, then you have learned various types of shock. I'm talking about the septic shock. All right. So, fever, low blood pressure, coagulopathies. These are the clinical features. Okay. Now, that was within your body, through the nerves, through within the inflammatory cells, proliferation and dissemination, through the lymphatics, okay, and through the bloodstream. Okay, those were the routes of transmission. Now, that is within your body. Now, from person to person, all right? Okay, that can be through shedding of the skin, coughing, sneezing, voiding of urine or feces, during sexual contacts, and not person to person, through, from one host to another, through insect vectors. Sorry. Okay. So depends upon, when it's going from one person to another person. Okay, it depends upon how fragile or how hardy is the microorganism. Okay, so and how long can it persist outside the body. Okay, that determines the infection. So they are transmitted, periodically during disease flares, or they can be transmitted. Somebody can transmit it over a long period of time if the patient is an asymptomatic host. Okay, we do not know, the patient does not have a symptom, and that patient is very prone. That person is very prone for transmission. So, any important disease in the history where asymptomatic host has caused a significant disease? Hmm? Hmm? Typhoid, right? Who was the cook? Typhoid Mary, okay. Angelic fever, right? Okay. Alright, from person to person, so transmission is from person to person or from a vector, or from animals to humans, direct contact, okay? Or consumption of animal products. Direct contact, name of the disease? Transmission through eating infected, consumption of infected animal products, name of the disease. Name of the disease I've left for you. Okay. Yeah. What is that? Tinea? Sonia. Right? Uncooked or poorly cooked? Pork meat. Right? Okay, good. Okay, so vectors, Plasmodium, Leishmania, malaria, and Kala Azar. Right? Yeah. Here, person to person, all this. Okay, saliva, sexual route, fecal-oral route. This one here can cause cervical cancer. Okay, even papillomavirus. Respiratory route. Okay, roots. Now where are we moving to? Huh? Roots occur next. Host-pathogen interaction. So, in the host-pathogen interaction, I'll briefly touch upon. We've kind of, had a look at it, but host defense. Then we have a list of 8 to 9, things where this 8 to 9 possibilities where how the microbes can evade the normal immunity. Okay, where all can they evade. Okay, they can circumvent or avoid, or they can bypass that. Okay, so that you'll have a list of 8 to 9 things here. Okay, and yes, like we said, when there is an infection, there is an injurious effect due to the host's own immune system. Okay, and what about those people who do not have a good immune system, immune deficiencies? So we'll just lightly touch upon each of these. All right, maybe it will merge somewhere. Okay, you may not see the demarcation very well as it is mentioned here, but this is for you to recall if you have to write, then you can just touch upon these points. Okay, that's why it is mentioned here. Is it clear? No? Lost? People normally sleep in my class. I already saw some of them, dozing off. I don't know why. Okay. Now, so the outcome of the infection depends upon how the host reacts to it and how virulent is the organism. Okay, either the infection is controlled or it is exacerbated. Who wins? That's the thing. All right. Or and then there is a host tissue damage. Okay? So yes, who wins? Okay, virulence. What degree of severity, okay, is its capacity to cause the infection, that particular organism? How virulent is that particular organism? All right. So, and we normally try to eliminate the infection. Okay, there can be exacerbation. Okay, which can be the principal cause of our damage to our own tissues. Okay, inflammatory disorders, immune-mediated disorders. You'll be learning all that in Unit 1. Okay, autoimmunity. Okay, then inflammatory disorders, then immune deficiency. Okay, acquired and congenital immune deficiency. Acquired, everybody knows, AIDS. That's what is going to be taught, very important, one class. Then congenital also, you should know. Okay. So we are preparing you, this in the Unit 0, we prepare you for so it's the basics of everything that you're going to read. Alright. That doesn't mean you'll not get questions. Okay. So now the host immunity, the host factors, integrity, how intact is the defense mechanism of the host. Besides that, there are certain factors, certain hereditary factors, certain factors related to age of an individual. In general, older people are more prone to get the infections. All right, and then what is the behavior of that particular patient? Okay, and what is the status of his immune system? Is he immune deficient? Okay, so these are the factors in the host. Okay. One is how intact is his own immune system. The first one and the last one are almost, a spectrum there. Okay, or how deficient is he? Okay, is his immune system. Then what is his behavior like? Does he have a promiscuous behavior? So he's prone to contact sexual transmitted diseases. All right. And does he take? Is he IV drug abuser? Okay, so that is one thing. Then age has its own, effect on the disease. Okay, so some diseases contacted in certain age, the patient is able to fight the disease well, whereas the same disease, like you saw in the trimester, right, rubella also. Okay, so that kind of thing you can write here. Okay, and hereditary factors. Okay, so. Host defense, the anatomical barriers you've seen the microbial flora. If we destroy that, then we are prone to get infections. All right, body secretions themselves have immunoglobulins and they are protective. All right, like saliva, tears, cervical secretion, urethral secretion, prostatic secretions. All right, in the GIT, in the respiratory tract. Okay, they themselves are protective. All right. Then we have again some chemicals which are protective. All right, they can destroy the organisms. All right. So, but there are certain organisms that cannot be destroyed and they cause the disease. Okay, which you have to fill in the last column. Okay, gastric and bile secretions. Okay. Then we have a number of phagocytic cells. Okay, inflammatory cells having phagocytic activity who can phagocyte and destroy the organism. All right. So this is there. That is our host integrity of our host immune response. And in hereditary, it's certain ethnic group, they lack this Duffy blood group on the RBC. So it is said that this Duffy blood group has the affinity to bind into the Plasmodium vivax. Okay? So these people don't have it, they are immune to vivax infection. Okay, this is just an example. Then age. Okay, now rubella, you've seen cytomegalovirus and all that, more severe in utero, okay, than in children and adults. Diarrheal diseases, also, children, there's high morbidity and mortality. Okay, diarrheal disease in children are important. Okay, they may not be the manifestations may not be as severe in older children and in adults. Okay, so children less than 5 years, less than 3 years, okay, are more prone to be the infection can be more severe here. Okay, Then tuberculosis also, if in younger age, okay. Otherwise, in young adult, they can fairly fight the bacteria, all right, or microorganism. Then Epstein-Barr and varicella zoster, on the other hand, they are milder in symptoms, milder and less symptomatic in children, but more symptomatic in and severe in adults. Okay, and like I said, elderlies, generally old people, they don't fare very good with. They are likely to get infections. Okay. Sexual behavior, we kind of touched upon it. Okay, I told about it. You can refer to this slide. And after that, walking barefoot. Okay, you're prone to get these worms. Okay, all right. Then food and drinking habit, contaminated water, unpasteurized milk, improperly cooked food. This is all related to your behavior. Pet lovers, dogs, cats. Okay, you are prone to get certain diseases. Okay, and some unhealthy traditions like cutting the umbilical cord with sickle, right? In the villages, what can happen? Neonatal deadness. Yes. Okay. So, right. Okay. Oh, it's written there. Okay. So, immune status, immunocompromised. Okay. Either there is an immunosuppressive therapy or anti-cancer drugs, or he has this disease. Okay, where this is an acquired immunodeficiency syndrome, or there is a congenital immunodeficiency in the patient. These two entities you will have classes of. Okay, AIDS and congenital immunodeficiencies. So, a patient may not be immunodeficient, but there are certain diseases which can, lead to the patient being susceptible to a disease. So, non-immune diseases, okay, which can, or injury, which can make a patient susceptible to a disease. In cystic fibrosis, okay, they are susceptible to respiratory infection. Cystic fibrosis, you will learn in unit 2, okay. And in cases of sickle cell diseases, okay, the macrophage may not function, there, causing the patient to be prone to, pneumococcal infections. All right, and severe burns, again prone to infection. There's so much of damage to the epidermal barrier. Okay, but that is not an immune deficiency in itself, right? But you understand the point. But there are certain diseases which can make the patient prone to developing a disease. Okay, what have we done so far? I see people getting lost and talking to each other. 15 minutes left. Somebody ready to recapitulate the class? Yeah. What did we learn? Do you want to answer? Very vague? Very difficult? Anybody here would like to answer? It's okay, you can make mistakes. Yes. How did we start the class? You go to a movie, you come out, you remember the dialogues, right? Then we were talking. It depends on how much interest you pay. Alright. You're paying for the class also. So pay the interest also. Your interest. Be here. Yes? Anybody? Very bad. Girls? No, nobody's looking at me. Suddenly. I have to pick somebody, right? You have your roll numbers assigned? Yeah? Who's the first roll number? First roll number, yeah. Thank you. What your notes?
First of all, we read about route of entry of microbes and different routes like skin, where infection is due to injury to the mechanical barrier. And then after, it's GI tract
Yes.
and respiratory, urogenital tract.
Very good. So
But
can you just give one each in the GI? I don't remember everything. Something in the GI. Everything in itself can be connected. The acids. Alright, then.
the respiratory system,
That's what it is. The respiratory.
uh,
Two columns only. Okay.
for larger arteries, small.
Yeah. Forget about that first and all that. Mucociliary and macrophages in the alveoli. Okay. Then. Urogenital. Urogenital. You see, avoiding of the urine is compromised, obstruction and all that. Okay, so oil distillation itself. Second, urogenital item. So think of the female where the vaginal flora can be compromised. Okay? Okay. And then there can be obstruction, there can be many causes, right? Voiding of the urine can be compromised by many. But you can, go back, revise and make it small points that you can remember. Don't read too much. It's very difficult to remember everything. The idea is that you should be able to, clear your exams like something. Okay, so just read point wise and put it all there. Okay? And go back and do that today. Okay, then what else?
Vertical transmission.
Hmm?
Vertical transmission.
Vertical transmission. Very good. Can you give me three?
So, placenta,
Placenta, fetus,
then
during birth,
and postnatal.
yeah, and then
Postnatal.
postnatal. Yeah. Two,
Breastfeed.
Very good. Okay. And one infection in the placenta.
इसमें rubella.
Yes, the first right. Okay, then what else?
Spread out.
Spread. Very good. Spread. It will go. The organism has reached. Then it will go to the inflammatory cell. From the inflammatory cell itself, it can, spread, or it can go to the lymphatic system to the bloodstream. Now, important is through the bloodstream. Goes to the bloodstream, then there's a chance of disseminated infection, depending, of course, upon the virulence of the organism and the host defense mechanisms. That is always there. Okay? Then another thing, another wing that you should not forget is through the nerve. Better nerves. All right. Okay. So what does rabies manifest as? Hypovolemia. Disease affects the yes, but it's transmitted through the peripheral nerves. Okay. So they ask you where has the dog bitten you? Near the head or not? Right? Near the head. So that's also one of the risks, right? Okay. So just went out of the topic. Okay. Then after that, spread. So spread is within the body and outside the body. Outside the body? Yeah, person to person. Okay.
And then vectors.
Vector.
And animal to
Handling, animal handling or eating infected animal products. Very good. What else did we do? Immune response.
most
Pathogen
pathogenic
interaction. Most pathogen interaction. What are the broad things that you have to remember?
Most defense against
Most defense. Just can write few things out relatively. Okay, then. Yeah. Immune evasion by microbes. Okay, then. No. Okay, yeah, I told you 4 points. Then they can be immunodeficient. Then what was one more point? Was distributed? Not working? This is not working? Injurious effect. The host immunity. That's what. What's your name? Alok. Okay. Where are you from? Janakpur. Okay. Good, Alok. Very good. Alright. So, the microbes, see, I have not gone into the details of this, okay? Because I think it would be too much. So, you can just keep this in mind and correlate it when you do the individual disease. Okay, come back to this and read this particular paragraph, okay, when you go to the individual disease. So, there can be some microbes which can, change their antigenic expression, change their coat, okay? Or they can totally, give rise to a different strain. So the body is reacting against one type of antigen and they change it, the microorganism. So antigenic shift and antigenic drift are the two keywords here that you can go back and look. Alright, so they can change their antigenic variation. The antigenic variation is there, they can change their expression. Okay? Then certain organisms which are resistant, which exhibit resistance to the antimicrobial peptides produced by the body, okay, some of them, they don't get killed by the phagocytes. They are in fact multiply there. Okay, so when you are touched upon this kind of, when each disease mark, you will be taught the pathogenesis. So if this is uttered, you can come back to this chapter, okay, and read through. Each of this is elaborated in Robbins. Okay, all right. So now you sensitize yourself to this list only. Okay? But yes, you have to come back to this when you are dealing with the individual diseases. Then evasion of apoptosis and manipulation of host cell metabolism. Resistance to all these cytokines and chemokines and complement-mediated host defense. Evasion by recognition, they hide, they cannot be recognized by cytotoxic T cells, neither by the helper cells. Exploitation of the immunoregulatory mechanism to downregulate the antimicrobial T cell response. What disease must this be? Suppressing the T cell response. So they establish a latent infection. They lie low and they come out when this atmosphere is favorable for them to grow, alright, and cause the disease. So, and then in general they affect and interfere with the function of the immune cells. So these are the headings, okay, how they evade, okay. Now injurious effect was that that small topic that you had forgotten, Alok, so you will not forget now because you had the courage. Of course you didn't have the courage, I had to pull you, but you did very well, okay. So this is manifested as granulomatous infection, okay, which you have read, right? Yeah, what are the 6 causes of granulomatous diseases? Name 6 granulomatous disease. Revive amounts. 4. 2 marks. Huh? Tuberculosis. Everybody will forget. I don't know why in the exams I get so big. Tuberculosis, leprosy, syphilis, cat scratch disease. Then what else? Huh? Sarcoidosis. Yeah, but it's not infected, right? Then you can, but when you ask granulomatous, you can say some more. Read, okay? Damage to the hepatocyte following. Okay, so if in hepatitis you will be learning in your unit 3, okay, there is a damage to the liver because of the immune response. Okay, so host damage due to immune response, that's where we are. Okay, so granulomas, okay, necrosis, tissue necrosis is a form of cell death, isn't it? Now, hepatitis B virus infection, hepatitis C virus infection in the liver, they cause damage because death, apoptotic mediated death, no, these viral will cause, okay, they can cause inflammation and death. So damage to the hepatocyte. Antibodies, okay, produced against one type of disease. Now that will go and that antibody will cross react with the normal part of another part of your body. And this is giving rise to your autoimmune disease, where very important you will be learning of rheumatic heart disease. Okay? Alright, so that or SLE. Okay? So here it is due to the against the streptococcal, it is against the cross reaction against that M protein of the streptococci. Okay, the heart muscle, okay, now the antigenic similarity to the M protein in the heart, okay, so these antibodies, because of the antigenic similarity, will go and cross react and damage the heart and manifest as rheumatic heart disease. So streptococcal sore throat in children to be taken seriously, right? So sore throat in children, you have to know whether it's streptococcal or not, isn't it? Because there is a chance of rheumatic heart disease, right? Then immune complex is formed against one type of bacteria, and that immune complex is now going and damaging your kidney, causing acute proliferative glomerulonephritis. This you will learn in kidney, very important disease. Okay, against the streptococcal antibodies. So these are some of the examples of diseases which are caused by, which are an example of host tissue damage in the course of reacting against the disease. Alright, did you understand? Host immune response, okay, to the microbes being itself a major cause of the host's own tissue injury. You understand? So if I ask you, name 4 examples of name 4 diseases which are caused by which are a consequence of the damage to the host tissue due to the immune reaction against the pathogen. Yes, 2 boys there. Please answer the question. You have a class after this? Yeah? You have a class after this? Boys, 2 of you were yapping away. Yeah? Answer, what was I talking about? While I'm here, you listen to me. Yes, please. What was I talking about? Can't see anything here, but I was talking nice and I was discussing very nicely. Yeah? What's going on? Please do not do all these things in my class. Okay? What's your name? Both of you? Huh? Virendra. And you? Gaurav. How many Virendras are there and how many Gauravs are there? Just one each. Good for me, bad for you. Alright? Okay. So, alright. Now we have to end the class. Immunodeficiencies I will not cover because I've talked about it. There's no point reading the PowerPoint. Okay? So we have talked. Yeah, one important thing that you have to know is what is an opportunistic infection. This is the terminology that I wanted to introduce. Baki to we have talked about immunodeficiencies, right? So organisms which cause the disease in immunodeficient individual, but not in an intact individual with an intact immune system. So there can be certain important opportunistic infection caused by certain microbes, okay, which normally do not have the capacity to cause or manifest an infection in a normal host, but the minute the host is compromised, deficient, then they can cause significant diseases, right? So that they are the opportunistic infections, okay? So, mechanism of viral, mechanism of bacterial, and then we go to systemic response, okay? So we don't have much time. Viral, so this is the host damage by microbes. Viral, they have the affinity to certain cells, and this is known as tropism. So what is tropism? What is opportunistic infection? What is virulence of an organism? Okay, what is sepsis, which you've already done. The class has been covered. So these are some of the terminologies I wanted you to introduce to you all. Alright? So here, the HIV virus, it has a tropism for CD4 T cell or the chemokine receptor on T cells and macrophages. So in the pathogenesis, this will start from here. Epstein-Barr virus on the complement receptor on B cell. JC polyoma virus, in fact, have the tropism for the oligodendroglial cells in the CNS, okay, manifesting as encephalopathy, right? And enterovirus and rhinoviruses, they have tropism to the barriers, like enterovirus to the GI barriers, gastrointestinal, okay, they can, adhere and replicate there, whereas rhinovirus, it has the tropism to the upper respiratory tract. Okay, it can flourish there. Now, okay, virus can cause injury by all these things. Leave it there. Then bacteria, they adhere through adhesins or pili, okay, that they have, and they invade and they cause the disease. Okay, and they can in disease causation, their exotoxins and endotoxins are also implicated, that are produced by the bacteria. Now, this is spectrum. This is the last topic. There are other pictures also, but I'll just talk about one slide. So, what is the topic? Spectrum of inflammatory retinopathy. I said this is the last point in the content that I had told, and this is the morphologic manifestation. Whatever is the spectrum of the microbes, or the variety of the microbes that you may know, virus or bacteria or the fungi or protozoa, okay, the morphologic manifestations of the disease, okay, in the tissue is limited to just few, all right. So either it is a pyogenic infection, the neutrophils forming abscess and all that, or it is a granulomatous inflammation, okay, or it is a cytopathic and cytoproliferative reactions, like there can be bulla formation. There are many vesicobullous diseases, okay, which can cause in the skin by certain organisms, okay, or cytoproliferative is viruses we usually see intranuclear inclusions, multinucleations, okay, as a morphologic manifestation of certain viral infections. Then tissue necrosis. Certain microbes, okay, have the propensity to cause large areas of necrosis, okay, like in your necrotizing fasciitis, isn't it? I mean, all these conditions in the infections of the fascia and all that, okay, toxic shock syndrome, all that, okay. So you will see these necrosis and tissue necrosis. Then chronic inflammation and scarring, okay, like in hepatitis. Hepatitis will have an acute course or also have a chronic course. Hepatitis A, E are generally causing acute hepatitis. Chronic hepatitis are caused by B, C, isn't it? Hepatitis B, C, they cause chronic damage, chronic scarring. Alright, so just some pictures: neutrophils, suppuration, granuloma, okay, that you have done. And yeah, this is a bulla formation, okay, in the herpes virus. Okay, this is again viral giant cells, cytopathic and cytoproliferative, chronic scarring and inflammation, tissue necrosis. Okay, techniques. That's all. This is the last slide. So just how you can detect them. Okay. Any doubts? If any doubts arise while you are eating, you're welcome to come visit and clear your doubts in the office. You know where our department is, right? First floor, right here, okay? You've seen us passing by and all that? Yeah? No. You seen me the first time? Have I taken any other class? Oh, thank God. Okay, so you know, okay. Otherwise, you students don't know. It's very difficult. Maybe many of us look similar, so it's difficult at this point. Alright, so any doubts? Please come, clear your doubts. You have a class after this? No. Okay, so when you read today, maybe there are a few things that you may not understand. Okay, then you can always welcome.
Thank you, ma'am.
Okay, students, let's go. Roll number 13,
Sorry.
14, 15, 16,